we start to have PubHlth1 class again, week 3. As you remember last time, we were talking about specific disciplines in public health. So some of them was, of course, epidemiology, statistics. I already, finished everything about the statistics. You were able to hear the short video clip about the role of the numbers in public health. So now here is the chapter 8 about explaining a little bit about the role of data in public health. You already know a little bit the information why we need to have the data. You already can almost partially explain that we need to have that in order to see if the program is working in the proper way, how it's done the evaluation, do we need to improve our program, and also to realize you were learning that about the raw data or raw statistics and adjusted, not statistics, but the rates, like raw and also adjusted part. So it means that we really need to have the numbers in case we see what's happening with the population. Is there higher risk for the disease, or it's everything we were able to conquer the diseases? So as we will be talking about that today. So, and of course, the data, the numbers, we need to have it also for the research. And you already know the different type of the research studies, and we need to work with the numbers there, with the data. When we talk about the notifiable diseases, you already know that information. The notifiable diseases are the diseases that they needed to be reported to public health department. Who is reporting that? Do you know? Do you remember that? Yes. Okay. So you already mastered that one question from the midterm. So yes. So they are the diseases that need to be reported. So, and also we need to see the data. We need to see how many patients in that specific area they were reported with this specific notifiable disease. So they are all the data that we really need to know from public health perspectives. How we will get the data? What do you think? What we need to use that? You have already the word here, surveys, okay? And it probably happened to you that you receive the phone calls and they will, introduce themselves like, yes, we are, from this and this organization, or we are part of that research project, and we would like to, do you have 5 minutes time? So we would like to ask you some questions. So if you do this, so this is part of the survey. So you are part of that, collecting of the data. So that's another, you would like also to have the data about the population. Each country, they are also doing their own surveys and information about their population. So it's the information that we can eventually use later to find out what we need, what kind of programs need to be developed or applied for the specific population. So this one, the census is done every 10 years. We also need to know that, and we already talked about that, some specific errors that can happen, or we can talk also what can be done through the adjustment also to make the data as accurate as possible. So also when we sometimes talk about, social economic situation is influencing this outcome of the health for the specific population. So how we know about that? So we put the results of different surveys together as a data and trying to find out, are there any correlations between that? What is sometimes when you hear about the background or demographics about the specific population, so these are the resources that you are using to find out this is the specific description of the population in the specific area. So when you look on that, you realize we really need to have the data in public health. So there are different type of the surveys. You can see there are different names, there are different organizations. Many of them, because they were applied many times, so there is a process of standardization. So this is another thing that when you will be doing the research, you can use some standardized survey tests or questionnaires. So they were already done, they were applied in many different type of the research. So surveys are the things that we are using to collect the data. And even when we talk about, and I'm going back like Framingham study, of course, they have the survey. So it's necessary to answer the questions in that survey, and after a certain period of time, it's again answered the same if there were any changes, and you are comparing that. I already mentioned that data collection is not 100% perfect. Actually, if I will be joking about that, almost nothing is always 100% perfect. So, but we need to find out what could be or how we can deal with some kind of imperfections in that. Do we have any additional tools or methods how we can, make that outcome or the information as accurate as possible. When we talk about confidentiality, so this is another still like the information part in the debate, because it will be very, very easy to transfer, the information or health information of the patients or specific information that we need for development of public health programs, but there are specifications that the data are, or some of that information has, there are confidentiality connected with that. So we have to also follow the specific regulations. Discussions. If you look on that, on collection of some of the data, especially like records collected on death or on the birth. Sometimes you would be thinking like, well, how come in the specific area there is higher occurrence, if you look on that death certificates, so maybe it looks like there is higher risk of occurrence of some specific causes that is leading to the death. So you need also to check, is it possible that could be some kind of administration error? Because it sometimes depends, not just from location to location, but sometimes also among and between the countries, that a little bit some definition of some of the disease, or making a decision that if this belongs to infant mortality or newborn, or the little bit older group of the children when they are dying. So you need to find out if they really recognize the definition of that specific disease or viability that is the same on all the locations or on the countries. Because the first thing sometimes, and they call that, the epidemiologists call that as an administrative artifact. So it means that could be maybe the administration problem in that. So that's the first thing you have to find out, and then after that you will be realizing like, yes, if the definition is the same, why is the problem in the specific location now that we have more numbers in infant mortality to compare with other location? Can we do something about the public health from the public health perspectives? This is the website. I will definitely recommend for you to go through the website and explore that and realize what all information is possible to get from this specific website. Of course, you will be using it because when you do research and when you develop the public health programs, you will be using information on that website for development of the programs. So this is a little bit information about like why we need to have the data in public health. Now we are coming for the completely new, different topic, and it's about that infectious diseases. And there are two groups. One group is like conquest of infectious diseases, and another topic is like challenges. What are the new type of the diseases that they are occurring, or maybe because there was some resistance done to the medication and that diseases are still coming now and occurring. So when you think about the conquest of that infectious diseases, do you have any ideas what kind of representative of the diseases could be in that section? Any ideas? I'm coming. Oh, you already started? Somebody already wanted to tell me. Which one?
Measles.
Yeah, so for example, yeah. So if you look, this was the diseases that, if you look on them, many of the diseases was really very, very big problem for the population. Some of the diseases we already have the eradication. Some of that we have already vaccination. Some of them we can use the antibiotics, so it's not very fast spreading of the disease, or we actually from the public health perspectives, we did some kind of like conquering of the disease. But if you look on that, yes, so it's many diseases. So if you think about achievements in public health, so this is quite, you know, getting like applause to public health because it was possible dealing with many of the diseases that you see the slide on that. This is showing you the graph and also the time that was possible in the specific sections or specific timeline to decrease the occurrence of some of the diseases. There are, of course, changes, and you see that the changes started to be if there was the you know, new type of medication was developed, vaccination, occurrence of antibiotics. So it's some kind of levels that it was a little bit higher, going lower with the specific diseases. So what is the role of public health connected with infectious diseases is like what we can do about that. When we talk about public health infrastructure, so this is something about the purification of water, pasteurization of the food, providing immunization. So if there will be the questions also on the midterm, so what were the steps in public health helping us to conquer the problem with infectious diseases? So it's part of the public health infrastructure. If you look on that, so when we talk about purification of water, you know, personal hygiene, it's now we call it like, oh, it's the standard things. But if you travel to different countries, it's not always everything like that. The public health infrastructure is not completely done in all of the countries, because therefore you can see that sometimes if there is some situations that is maybe the natural disasters, or it just happens from not keeping the public health infrastructure in the proper way, that people will get sick. So if you look 1960, so it's not a long time ago, 1960 was discovering of antibiotics. So it was a huge, big change in public health, because from this it started the process, yes, we are using the antibiotics, so we can use that for the, you know, minimizing the risk with infectious diseases. Before 1960, they were thinking that garlic will be part of that, you know, using for conquering some of the diseases, because garlic on its own, all the phytochemicals and components in garlic are connected with some kind of function as antibiotics have. So I don't know if any of you heard about that, but in Russia they were thinking like garlic will be like their antibiotics in that time. But this was the discovery in 1960. So between 1960 and 1970, when I talk about profession of public health, I can talk also about the way that people were thinking like, oh, we don't need to have so much of public health because we have antibiotics, everything is conquered, everything is going in the proper direction, so do we really need to have public health providers? Well, we still need for the surveillance, so as you already know the word surveillance, in case they are, and immediately monitor the differences with occurrence of different diseases. We need still to have public health policy. And now what was happening is development or occurrence of the chronic diseases and new infectious diseases. So when we talk back 1960, and you remember the video clip about the development of vaccine, so this was really quite crucial, achievement in public health. So that was two things, immunization and also antibiotics. I will have additional slide soon. I will show that to you about different form of immunization. We have active form and we have the passive form. If it's the active form, so you are receiving like the weak actually pathogen, and the body is developing the antibodies. If you have passive, so it means that you are already receiving antibodies in your, when you are receiving the immunization process. So there are different forms and how they are developed based on different disease. So I already mentioned that. Antibiotics, yeah, I already mentioned that. With antibiotics, it's also very, very important to talk about Robert Koch, Dr. Robert Koch. In that time, you probably still remember I was talking about debate between Koch and Pasteur. You already know an association, the name of Pasteur is pasteurization. So he was in that process that if there will be elimination of pathogens in the environment, there will be no disease. But Koch, he developed the Koch postulates, so he was always thinking, no, it's not just the elimination of the pathogens, it's also like what is the environment in that human body. So we need to concentrate on the pathogen and to develop something that the pathogen will be, not only that will be not occurring, but also what is the environment in the body. So the Koch's postulates, this is something that you need to know. They are the 4 Koch postulates. And so in that time, now it's almost like obvious. Yes, of course, we have the specific process, like we know that this bacteria, we know about the identification, we know about the correlation and connection of that pathogen with the specific disease. But in that time, they were not sure. They didn't know if this person has the disease and if the other person has the same pathogen or not. So therefore, he developed the postulates how to be sure that this is the disease, and if we apply any type of the therapeutic approach, the pathogen is actually not existing anymore in that environment. So you need to know these 4 Koch's postulates. So it means organism must be present in every case of the disease. So that's actually like a definition about that. The organism must be isolated or grown in the laboratory. Then, if it's injected, whatever place that is, or if they did the experiments with animals in the time, so it must have the disease. Now, many of that things could be used and monitored through different software programs. So we are minimizing the effect of usage of animals in this form. And then when it's isolated, and also the whole process must be repeated. So now it's like, well, why we are learning about that? It's obvious. But again, you need to learn a little bit like what was not obvious in that time, and so how they came to that results, that to know, yes, this is the specific disease, this is the name of the disease, this is the definition of the disease, because it's the repetition with the same symptoms of the disease. So when they actually have the debate between Dr. Koch and also with Pasteur, so eventually Pasteur, he was dying earlier, so he called Koch, and he admitted, yes, it's not just the elimination of the pathogen. We also have to work on the environment of the body of the person, but in general forms about environments. We have different agents, infectious agents. When you will have microbiology or immunology, you will be learning a little bit more into detail the information about this, but this is just giving you the basic principles of that. So we have the bacteria. You need to know also the basic diseases that they are of bacterial connection. So it means they are caused by bacteria. So like tuberculosis, cholera, typhoid, tetanus, and all of that. So you need to know this, what is connected with this type of diseases. And some names of like streptococci, staphylococci. So they receive the names also based on the shape. So I know I just did that for fun, but this, I mean, if you still remember the first video clip that I was showing to you about the vaccine and about Pasteur and Dr. Pasteur and all of that. So this was the time, that was the development step by step. So they were like thinking, well, we have to name that specific bacteria. So maybe very easy it was based on the shape or based on who discovered that specific, or he was making that visible that the bacteria was here, but it was discovered like, yes, it is here. So they were connection with the names of that bacteria or the diseases. I already talked about this one. This, you probably remember that it was in the beginning, the first week probably, I mentioned to you about this very important wisdom. It is more important to know what sort of patient has a disease than what sort of disease a patient has. So please remember that. This is very, very important. It's just, if you look on that, it's almost 100 years old, this wisdom, this citation here. But it was for a certain period of time, it was forgotten. And it's very important to realize that, and because this is the part that you are involved in public health and lifestyle management. Additional infectious agents is virus. So you need to know also what type of diseases are connected with virus from public health perspectives. So the representatives here, you have like smallpox, polio, hepatitis, yellow fever. So if we have the viral infectious disease, so mostly we are dealing with immunization process. Then another that belongs under this group, they are also parasites. So you need to know also what type of diseases are connected with the form of parasites. So again, from public health perspectives, when we talk about infectious diseases, because the spreading of that infectious diseases is quite fast, so you as a public health provider need to be aware and need to know the basic information about that. And I'm sorry, I just didn't change that, but this is like, I would like to see that everybody's awake in the class. So they are the different type of infectious agents. And again, if you look on that, they decided maybe because of that shape and style or what the specific infectious agent was doing, the pathogen, so they gave the name. Now, very, very important from public health perspectives is the means of transmission. You will see a few video clips. So I would like that you are really, again, observing the process of transmission. You were able to see that a little bit on the West Nile virus. So there are different forms. You can get, or the transmission could be through the aerosol, it could be through the touching the contaminated objects, it can be through the water, there can be vectors, and that could be also the behavioral of the human beings, so sexual contact also can transfer the disease. It's very important from public health perspectives quickly make the diagnosis or find out what kind of pathogen could be involved in the process, because then if there is the familiarity with the pathogen, you can quickly give information to the public. Oh, you need, there is the disease that can be transmitted through the vectors, so maybe you have to, which way you can protect the public from spreading the disease. So you need to know also, this is very important for you to be aware about different means of transmission. Chain of infection. So it's also very important to know what are the reservoirs. If we know what are the reservoirs, maybe we can implement some specific forms from public, or tools from public health perspectives, that we can minimize the risk of spreading of disease, that maybe we will concentrate on the reservoirs. or if there is the problems with rabies, so we will probably, there was done the surveillance for the animals. Also the veterinarian physicians with a connection of public health were doing were involved in the surveillance, and so it's this, if this is the risk of that, so you already can minimize the risk to taking care of that process. If there is person eating that food, therefore we have, or it's the risk from the food what you are consuming. So therefore we have the public health specialists that they also go, and there is the checking about the food. They go to the restaurants regularly. And they follow, the public, and checking if the workers are keeping the public health policy. So this is something that if you know that could be the transmission of the disease, you are trying to check the reservoirs or check the means of the transmission. What about the low immunity? So here we are going back to the Koch, that he was thinking, yes, it's very important, what is the environment on individual level. So low immunity. So what we can do about that? Some of you will tell me, oh, we will be doing IgE, vaccination, immunoglobulin, so we can increase the immune system by doing this process. What about to have the active process for each person? So how can you improve the immune system? Do you know a little bit how you can improve immune system on its own? What do you have to do? What is that? Yes, eat healthy. So eat healthy, it means what? Food with high level of antioxidants, anti-inflammatory diet, so you will have fruits, vegetable, grains and beans. Variety in that. Also, what you need to do is, if you have high level of stress, what is stress doing? Decreasing immune function. So work on your stress level, doing the stress management, positive self-talk, positive thoughts, all negative emotions, negative talk, just erase, eliminate, from your daily, life. Physical activity. So this is also improving the immune system. And very, very crucial, somebody can help me with that. What is crucial? I always tell you. Yeah, yes, laughing, humor, and enough of hours of sleep. Okay, so if you look on that, it's amazing. It's very simple, it's very important, and it's very easy, and you can improve your immune system. So that's just almost everybody could be involved in the process. Later we will be talking about the behavior modification. How actually this, everybody knows, like, well, this is connected with immune system, but how to persuade public to be involved in that? How to do that? What could be the obstacles? What are the barriers? So if you look on the immune system, so that's quite crucial that we need to have more public health education in that way. So what you as a public health provider, what you need to do is, if you look on the whole chain of infection or infectious diseases, and we already talked about it can be pathogen, way of the transmission, what is the reservoir, what is the environment on individual level. So we have to either to break the chain in every of that process. So if you break the chain, you actually can break the process of the disease. So it's very important for you as a public health providers to know about that. How you can interrupt that. So if you look like in the beginning, it's very easy. If you look like what is connected for triggering the disease, then of course how you will interrupt that, you will concentrate on that specific names or topics that they are connected with triggering the disease. So you will work on the pathogen, you will decrease, eliminate the reservoir, prevent the transmission. If you look on that, yes, there are some examples. What's quite interesting, if you look on many of the public health textbooks, so this is quite described there. But it's not enough information. Still, it's a little bit missing that I was just sharing with you before about improving the immune system, lifestyle modification. So it's on your shoulders, future public health providers. Be aware about lifestyle modification. This is like very simple, maybe because it's so simple, Everybody would like, to find, they think the really core science is everything what is just too complicated. So if this part is simple, that's very important to be involved in lifestyle modification. So not just using the antibiotics, not just using the immunization, but also, the process of lifestyle modification. So this is a little bit something what I was sharing that with you about lifestyle modification. I added few slides. You don't have that in your textbook. I added because I think it's very important for you as a future public health provider. This is something a little bit what I introduced to you in the beginning about lifestyle modification, about improving the immune system. So if, for example, now it's the season of the cold, season of the flu. So of course you are thinking, well, what is the transmission? It's through the aerosol, the transmission. It's also through the touch. So it's important to prevent that by doing the proper personal hygiene, providing probable immunization. Everything is correct. Everything is fine. But what is still missing there is the lifestyle modification. So it means what can each person do to improve the immune system. So number one, how you can improve immune system is like what you are eating, what is your nutrition. So we already know if it's overdone with caloric intake, it's decreasing immune system. I mentioned this, it's very short, in the brief information done on the slides, but it's based, and if some of you will be going through the research literature, there is a lot of literature showing, yes, higher caloric intake is decreasing immune system. Some studies are showing, yes, if you are able like 10% to decrease your caloric intake, you already improve your immune system. So think about that. We have the problems, epidemics of obesity. Does it mean that we have more people suffering from, repetition of cold and flu maybe in the beginning? You can hear like, oh, everybody has cold, everybody's running nose. Why is that? Is it some part of missing how they are taking care of their immune system? So caloric intake, lipids. So it means what is your dietary fat intake? So if it's higher level of the cholesterol, higher level of the free fatty acids, triglycerides, consumption of that, you are decreasing immune system. You probably see some titles or some names like leukocytes, phagocytes, natural killer cells activity and all of that. So they are components, they are the activities and components in the immune system. If you go through the research literature, you will not find just like immune system is improving. You will, because they also target on specific components there. And so you will see like, well, if the dietary fat intake is decreased, the person has lower level of the free fatty acids and triglycerides. So it means it's improving immune system. You have, if we talk about the fat, we cannot put fat, all of the fat in one group, because there are some components that they are good for immune system, and that's omega-3 fatty acids. Omega-3 fatty acids is like enhancer of the immune system. So what are the sources? Any of you know good sources? Don't tell me just dietary supplements. Yes, I know. But I know, I was like, oh, of course we know. I just go and buy the dietary supplement. But that's, of course, we need to have that too, because if there is low intake, from the food. But what could be good sources? Yeah. Fish. That not every, all fish, general level, yes, but if you would like to have higher amount of omega-3, it's probably salmon or mackerel, so that could be higher level of the omega-3 fatty acids. From the vegetarian, vegan diet, yeah.
You can also get it from some plant oils like sesame seed oil and olive oil.
Mm-hmm. Yes. Yeah, that's excellent. Olive oil, so it's the part of the Mediterranean diet. You have nuts, walnuts especially. You have flax seeds, seaweed also, the sea vegetables. You can have good sources. Avocado. You have good sources of omega-3 fatty acids. So how many of you had avocado last week? Ah, okay, that's good. So that you, in that time when you were eating that, you have some, you know, omega-3 fatty acids. So you were doing something to improve your immune system. Another thing is phytochemicals. Do you know, any of you know what are phytochemicals? Phyto, it means like plant. This is from Latin or from the Greek terminology. So chemicals, it means, of course, it's chemical structure. Don't always associate the word chemicals with something bad. We usually do that, but it's phytochemical. So it's the component in plants that they are helping plant to improve their immune system. So it means if you look, for example, on garlic, or you look on the onion. So it takes so long before this type of vegetable or fruits, some other components in fruits, will get rotten. To compare, if you compare that with the meat, animal product, that will probably get rotten much faster to garlic. Garlic can stay and stay and stay and it's still not rotten. Why is that? It's amazing. You wish, like, no invaders, you wish to have your body as a garlic, no invader, you know, of pathogens to get the flu or anything like that. Well, how can you do that? If you consume that garlic, you actually, because it's based on the chemical structure, it's based on the specific proteins and chemical structure in the human body, that we are able to accept these phytochemicals, these components, and we can use that also for improving the immune system, our own system. So just with the garlic, just very interesting thing is, if any of you will be traveling during the summer to Alaska, you know in Alaska it's a lot of mosquitoes. If you consume garlic, raw garlic, small piece every day, every evening maybe, so no mosquitoes bites. Mosquitoes don't like your blood, they like if it's the feeling or taste of sugar. So if you eat cakes, cheesecakes and candies, you will have a lot of bites from mosquito. But if you eat garlic, no bites. Well, maybe you also don't, you know, socialize so much, people will be, you know, socializing with you. No, I'm just joking about that. But you have to, you know, give the other people the garlic too, and then you have the garlic community and you will be fine. So, yes, so they are the allium, allicin, so they are already known, discovered phytochemicals in different type of fruits and vegetables. Remember also, all animal products, they don't have phytochemicals. Phytochemicals are only connected with plant food. So therefore, it's almost, you know, explanatory in the way, if you will be eating plant food, you are consuming the phytochemicals. When we talk about dietary supplements, vitamins and minerals, so all of them were possible to identify around the 1950s, around that time. With phytochemicals, it was just 1980s. So it's still not, you know, a long time ago, but there are completely websites with each of that different type of fruits or vegetables with identification of different type of the phytochemicals. So if you see, sometimes in the terminology connected with plants is called like natural pesticides. I know you hear the word pesticides, oh, this is the chemical things that we don't want to be exposed. But again, I am using the word natural pesticide. So if they call that natural pesticide, so it means this is under the group of phytochemicals and other components that the pathogens are not invading fruits, vegetables, and all the plants. So the great thing is that we can use that. So if I look on that, any of you were eating last week any type of the phytochemicals? I'm not asking about fruits, vegetables, but maybe lignans, maybe phenols, maybe saponins, any of that? Did you eat, any of you, last week? I hope yes, you have some fruits, vegetables. Okay, so be proud, you are like so scared now, like, oh, phytochemicals, I don't know. I know the word is like, making you feel like, well, I don't want to be associated. I don't know if I can be associated, you know, with the phytochemicals. This is good word. This is good, you know, all the names of that, like limonene, for example. So they are the components of the plant that can help you with improving immune system, and it's doing the justification why you should follow that recommendation to eat fruits and vegetables. What about the herbs? Of course, what you can see there, it's like herbs with anti-cancer activity. If you put the word anti-cancer activity, it means in general terms improving immune system. So what's happening for the cancer patients? The immune system is quite weak. So if you look on that, it's also connected not just with the vitamins, minerals, but also with the different type of the phytochemicals. If you look on that different type of herbs, also it takes quite long before they are getting rotten. So this is like, I know it's like some like very simple advice about that, but this is telling me, yes, this is the important part, that it's protecting the plant from being invaded by pathogens. So if you look on that, any of you have one or two last week? No? Ah, please, yeah, please be proud. You have to be proud if you have any of this. If you didn't have, I hope that after this class you will have, because otherwise you are almost going in the direction that you are increasing your risk to have cold around midterm. You don't want to have that. So pack yourself. I don't know which way. See, I'm using this strategy. Because if I will tell you like, well, please eat that, because otherwise when you will be at the age of 40 or 50, you will have increased risk for chronic diseases. Oh, this you will be thinking, oh, this is science fiction. I cannot see myself when I'm 40 or 50 years old. I identify with this when I was at your age. But if I will tell you to prevent to get cold connected with midterm, which is probably 2-3 weeks from now, you can see how the strategy can work a little bit. So this is another what I was practicing here. It's a little bit like when we will be talking about the behavioral modification, how you as a public health provider, not just you will be giving the information about, you know, education about the topic, but how to implement that and use immediately the strategic point in that. So if some of you are not consuming maybe 2-3 of them, you didn't have anything like last week, please start to think about that, because this will really, you know, it's strong, it will be improving your immune system. And it's very easy. Any of that you can add to your salads, you can, you know, it's very easy to eat that. This was the statistics done by 1994. So this is again showing you how numbers sometimes are important. Not sometimes, it's always important in public health. So if you look on that, and what you were able to see before, that if there is low intake of fruits and vegetables and beans and all that, so it's decreasing immune system. So if you look on that statistics, so what this can tell you, if the people are consuming, of course, it's probably like changed now because it was 1994. California is probably different in that. I cannot imagine that you will be eating 2 donuts per day. But unfortunately with the sodas, so 1 soda drink per day, unfortunately that could be sometimes correct. I hope not. I hope that you are using in all that buildings here at UCI, we have the rehydration station, so you can just have for free, you know, the filling of the water. Actually, if you know, downstairs in the first floor, you have that rehydration station. So, but if you look on that, so what this will tell me, probably, you know, if people will be consuming that, that will be the nation or the population with creating low immune system. So no wonder that, you know, it's risk with chronic diseases on its own, not just because immune system, it's other correlation with cholesterol level and so on. If you look on that, is what kind of diet is this? It's pro-inflammatory. Okay, so no wonder if people are consuming it for a long period of time, they have problem with inflammation in their body, autoimmune diseases that can be connected with diabetes, arthritis, and so on. Plus, also, I mean, general level, it's the immune system. If people are consuming high amount of this type of food, when you look on the potato chips, it's very common. You have the lunch, you have your box of the lunch, and it's always the little bag of the potato chips. It's just always correlated with the lunch. So this is, I mean, why it's not there, maybe always correlated one apple or something like that. Maybe they are, but it's even if with this, it's still the, you know, little bag of the potato chips. So if you look on that, yes, this is the diet to, if somebody will be consuming that, of course, it's based on the textbook that you are, you know, decreasing your immune system. So it's the diet in that way. Okay, so this was a little bit additional part. I wanted that you know about this. You will learn more and more in my other classes, like in winter I will be also teaching class the nutrition and global health. Now, when we talk about the infectious diseases, we still need to measure that. We need to do surveillance. We need to do identification. We need to write the reports. We need to ask the questions: who, when, where, sometimes even the what. That and providing isolations of that the specific individuals. Providing immunization, so it's just, you know, decrease of the spreading of that infectious diseases. Some examples how the public health is working. It's on the SARS, on the severe acute respiratory syndrome. If you look on that historical perspectives, so many of that infectious diseases, they will start like, or they are discovered just by the accident or just suddenly. There is a report about unusual experience of some symptoms. Then if this is, usually if it starts like that, in very close proximity of the time or the location, you will have more patients with different symptoms, and sometimes it's going through many of other countries. So, so this is actually the historical point from the disease. So this is the detective work that you have to be involved as a public health providers. Sometimes when the disease is here, there is no vaccination, so it's very important to start to work on that and develop that. It's also very important providing the laboratory tests. Another example of that infectious diseases is the rabies. So it's also, if we already know that is the reservoir is among the animals, especially the wild animals, so it's necessary to provide the surveillance. After the anti-communist system in Soviet Union, suddenly after the 1990, after probably like 5 years or 10 years after the process, was higher occurrence of rabies. What happened? Because many people couldn't keep their domestic animals anymore, so they just let them to go on the streets. And so, if you travel in that time, not completely, for example, like in Moscow, but in the vicinity, there was higher risk that the animals will be just running in that area, and it was higher risk to eventually, if there will be, the person will be bitten by the animal, that could be connected with the rabies. So when they realized that, so they got help also and trying to do the surveillance. But this is something that you would like to prevent and doing the surveillance, because even if you do, if there is the risk that the person already was in contact with the animal, you can still do the vaccination, but with every vaccination you have to be aware how this works, and it's not always comfortable for the patient. When we talk about eradication, you will see also the video clips about eradication, especially you will see the video clip about the smallpox. So this, if you think about form of eradication of the disease, You need to find out also how the disease is transmitted, what is the reservoir, can I see the disease immediately, can I recognize the disease, because there are many different factors that some disease, it could be prepared in the way that we can do the eradication. It's not always the situation. And I will show you the video clip that you will realize, and it will be mentioned in that video clip, why actually the smallpox was possible to eradicate. So I'm not doing more explanation about that because you will see on that video clip. Then, of course, what is the goal of the public health providers? To do more eradications of different, diseases. What we can do about that. Sometimes we have to be aware also if we would like to do eradication. This was the situation with DDT for malaria. So of course it looked like, well, this will be great, so that will be completely eradication of vector. Remember, you have that the cycle, and you would like to break the cycle, and if you break that, it's not, because as soon there is any components in that doesn't exist, then you can eradicate the disease. The problem with DDT, it happened that they realize one thing is that could be eventually develop the resistance of that mosquitoes to this component. Another was also that the DDT was soluble in the fat and still keeping and soluble in the soil, but also in the fat. So it means if the person were living in the area and they have higher percentage of body fat, so that was possible, that was the absorption and accumulation of these toxic components in the body and leading different type of diseases. So we need to be also aware from public health perspectives to check what kind of side effects could be from that. Sometimes it's not known immediately. It's possible to learn later. Also, fear about the vaccines. You will see that also on that video clip about the polio. It's already, you probably were able to read some information that was back like 1995, 1996, that was sometimes written or research also that maybe it could be some kind of associations of specific type of vaccination with maybe symptoms of autism. Based on that was also changed the components, how the vaccine was developed. Sometimes was used the mercury there because mercury was helping to keeping the vaccines for a prolonged period of time on the shelves. And if the children were receiving multiple, vaccines and they were sensitive for this component, that could be quite detrimental to the children's health. We still, but you have to check to compare if the vaccination is done, how many of that problems with the disease is prevented. And sometimes we call it another word, it's called like herd immunity. So you will see that also on the video clip. So this is the portion that, especially now, like everybody is immunized, so then parents also decide, well, I will not let my child immunize. So if the child is not immunized, cannot go to the school, it's going like homeschooling, and they are living under the herd immunity. So it means everybody around them are immunized, so they cannot get the disease. The risk is, in case they would like to be public health provider and travel to different countries, and now the disease is in that other countries, so they can get the disease. Or sometimes you are surprised, like suddenly we have some kind of disease that you think like, wow, everybody is vaccinated. It can happen sometimes that if the children or if the person is going to different area, they don't have that level of the herd immunity, so they can be exposed and get the disease. Okay, so this is, I will leave that on you a little bit to solve some of the forms of the discussion here. Be sure that when you go through different type of disease, you know what is the transmission and what is the chain of transmitting the disease. that could be some questions about that. So some example about malaria. So well, this is the, that is the vector for the transmission of the disease. This is the mosquito, so we have to concentrate on that. Rabies, it's coming from the wild animals, so we have to, do the chain where we will break the chain. So this is where we will interrupt the chain. So this is something, or what kind of level of education we will do. So it's quite important. And I will be going now to show you the video clips. First one, I would like to show you the smallpox, because it's the eradication of the smallpox. I would like that you check and you will be aware about why the eradication was possible to do. What are the most important principles in that with this disease that the eradication could be done.
With the development of vaccines for diseases like diphtheria, mumps, and measles, old viral epidemics began to disappear. When Jonas Salk produced an injectable polio vaccine, and Albert Sabin made an oral version, many countries organized massive inoculation campaigns that brought this relentless crippler to the brink of eradication. Vaccines were winning the war against viruses in the West. But in poorer countries, most viral diseases still flourished. Even smallpox, the first illness to have a vaccine, continued to claim more lives than any other disease in history. It killed without mercy, bringing a mask of agony to the faces of the dying.
And I remember seeing children with their faces swollen with hemorrhagic smallpox and thinking, isn't this a shame that it's the last view the parents will have of this child?
We had a huge hospital ward filled with smallpox cases. And as you walked past the beds, these people looked so distressed. And you could identify at least half of them who were going to die. A young British physician just put his hands on the balcony rail outside and said, "I cannot again do rounds on a smallpox ward."
In 1967, the World Health Organization decided to mount a global vaccination campaign to wipe out smallpox forever. But the disease was so widespread, experts predicted total eradication was doomed to failure. Even its leader was skeptical.
It was such an overwhelming problem. There was a time where we really had our doubts that we were going to be able to succeed.
For the mammoth task, Henderson recruited young idealists who immediately became known as the smallpox warriors. Later, many would rise to prominent positions in the field of public health, but now they were just doing their job, which meant getting the vaccine to extremely remote places.
A number of these had rather long hair. They certainly weren't individuals who were likely to show up and be well received at an embassy cocktail party, but they worked tirelessly. They were real heroes.
And they needed courage because their task was truly daunting. But they were spirited, and they had a vaccine that could be easily administered by scratching the skin with a special serum-laden needle. Smallpox also had characteristics that gave Donald Henderson realistic hope he could break the chain of transmission.
We always knew where it was. Wherever the virus was, the individuals had rash. And we could go into a village and immediately identify whether we've got a problem.
And smallpox could only be transmitted from person to person. There was no animal or insect also carrying the virus. So immunizing as many people as possible could hopefully break the cycle of disease. At the start of the initiative in 1966, 63 countries were reporting smallpox cases. One of the hardest hit was Nigeria, so the warriors went there first. The plan was to vaccinate 80% of Nigeria's large and widely scattered population. They were relying on a concept called herd immunity, which means if enough of your neighbors are vaccinated, you're unlikely to get the disease. But they soon discovered that vaccinating even 80% of Nigerians was impossible. There were far too many people and not enough vaccine.
We found ourselves looking for an alternative. How do we use the small amount of vaccine we have most efficiently?
Bill Faggy, who directed the campaign in Nigeria, was forced to rely on a strategy called ring vaccination to keep the program alive. When they found a smallpox case, they'd vaccinate only those people in the immediate vicinity of the victim. These vaccination rings would still keep the disease from spreading, even though only 15% of the population would be vaccinated. But if the warriors missed cases outside the rings, all would be lost. The problem was how to locate everyone with smallpox. Bill Faggy turned to Nigeria's extensive network of missionaries for help.
Lokoja Mission Station calling all parishes. Over.
We divided up the geographic area and asked each missionary if they would send runners to every village to find out whether they had smallpox.
If the runners found a case, vaccinators would quickly move in and place a quarantine ring around that village.
Suddenly we were able to put a mark on every village with smallpox. The bottom line is that smallpox disappeared from this area in a period of weeks, even though we had vaccinated only a minority of the population.
They also latched onto another valuable group who could provide intelligence: school children.
Is there anybody here that knows of someone that has this disease?
By holding up a picture of smallpox and saying, has anyone seen this? We soon found that little boys in particular between 9 and 13 years of age knew pretty much everything that was going on and were quite prepared to tell you all about it.
Over there.
Region after region began to fall to this strategy, with ring vaccination always the cornerstone of the plan. After 3 years of determined work, the smallpox campaign triumphed in West Africa. India, with the largest concentration of cases, became the next target for the warriors. But with its massive population, they would need other strategies for success. They recruited thousands of Indian workers to help them find cases. By 1973, they mounted a house-by-house campaign that was so well coordinated, they visited 100 million homes in just 6 days. But what they discovered alarmed them.
In one state where we were getting about 500 cases a week, suddenly the searchers found 11,000 cases in just this 1 week. It was a very black day indeed. There were those who said, you'll never get rid of smallpox in India.
Worse, the disease could easily spread among such a highly mobile population.
In the 1970s, 1% of the Indian population was on a train at any one time. And so you're thinking of millions of people moving around the state.
To try to overcome this problem, they created surveillance and vaccination posts at train stations, and they stood watch at markets and other gathering places.
There is a goddess by the name of Sitala Mata in Hindu mythology to whom villagers would make offerings for her to heal them if they were ill with smallpox. It seemed that it'd be a good idea to post people at the Sitala Mata shrines to learn where smallpox cases were occurring.
They also went into the countryside where farmers work long hours in distant fields. To get them to come into the villages to be vaccinated, Faggy enlisted the help of a creative chief.
He said, I'll get him back. And with that, he had his drummer begin pounding on a talking drum. People came flowing into the village. Almost as fast as people move by you, you can vaccinate them. After 2 hours, we finally finished everyone. I said, I am very impressed. How do you have such control over your people? He said, I told them on the talking drum to come to the village market if they wanted to see the tallest man in the world. I guess I look that way to him since I'm 6 foot 7 inches.
By 1975, after 3 years of hard work, India was smallpox free. This had been the hardest battle of all. The warriors could now smell victory. By 1977, the only cases being reported were in Somalia, in East Africa, mostly among nomadic families who were hard to track down. Later that year, 2 cases appeared in a group of nomads camped near the city of Merka. The victims were children, and a smallpox volunteer, Ali Marlin, was sent to bring them to the Merka hospital. Ali himself had been vaccinated, so he didn't fear helping the children. By the time Ali reached them, 1 child was dying, but he helped the others survive. And anyone who had contact with the children was vaccinated, so there were no more cases. But then the unthinkable happened. Ali Marlin himself came down with smallpox.
Ali was immunized, but he didn't have a take. So the immunization was not successful, and as a result, he was unprotected.
While Ali lay in bed fighting for his life, there were no other cases in Somalia or anywhere else in the world. Could the virus that had plagued millions for centuries finally be confined in just one human body in a remote hospital in Somalia?
For weeks thereafter, we held our breath.
When Ali Marlin finally emerged from the hospital, little did he know that he would become the last victim of this terrible disease, the endpoint in a smallpox chain of person-to-person transmissions stretching back thousands of years. The warriors had won.
I almost had the feeling like having been a soldier in war, suddenly there was no war, and you'd miss the camaraderie of your colleagues working out there.
This was the greatest public health accomplishment to date. Yes, smallpox eliminated a disease from the world. That disease is no longer present.
Okay. Any comments? What do you think? Why was possible the smallpox to be eradicated? We have a few more minutes, so we can just discuss that. I would like to, it was quite a strong video clip, no? It was, you will probably remember that, more than we will be talking about that, so it's something what you were able to see. So do you know if there will be the question on the midterm, why was possible the smallpox to be, eradicated? What was very crucial in that? Yeah. What is that? The reservoir, so it means that was only from human to human, so there was no something between that, because that if it's something between that, it's more complicated. Okay, what another thing? What is that? Yes, that we have the immunization, we have the vaccine. So if you look few different perspectives, one thing that we have the tool, how we can, what we can do about the disease. So we have the vaccine. We knew that it's always only transmitting from person to person. So if this will be done, and there will be there is no possibility to transmit, doing the transmission. What another thing? That was quite crucial. He mentioned that. Do you remember, little boy? They asked the question, where is another victim? You can see the disease immediately. So it's immediately, when you will see another one when we will be talking about polio, so you don't see that immediately. That was possible, he mentioned that it was very, very crucial to see the rash immediately, so they knew where the disease is. Sometimes if you have disease and it's the incubation period of time, you don't immediately see the disease. And sometimes you are coming and you don't know where can be the disease. So with this one, so that was quite crucial thing. So it was visibility, the level of the transmission from human to human, and also we have the vaccine. So we have the tool, what to deal with that. What another, I mean, if you look on that, you are probably through this almost like 10, 11 minutes video clip. You were able to see many different strategies in public health field. You actually saw almost like public health case. What other thing was necessary to do? I mean, even if you will have that and you know about this, what other things what was quite important, another part in that, in the whole process? Probably the volunteers also, and because it was also hard, one thing that you don't have enough of the vaccination, so they really found out what could be the little bit level, how they can do the vaccination, the strategy, but also they have the runners. Imagine that because you have to go, in order to eradicate it, you have to go to all the places. So that was very important to go from, and imagine that one going from door to door. And so it was in it was in Nigeria, but also when you saw in India, so what they have to do, you saw probably the train, and you will see that more on the polio vaccination. You have to find out what is the transport for the public, where they are going. So if it's the train, you have to go with the vaccination inside the train and doing the, you cannot wait like you already have the standard way that yes, person is coming to see the physician office and receiving the vaccination. This cannot happen because there are some remote areas. So, or you have to find out how the people are transporting and where you can get, the really a lot of the population you can do, the proper way of the immunization. So that was the crucial things and many of the strategic points. What do you think about that, calling that, like he was surprised, like, wow, how come all the people are coming from the field, coming for the vaccination? So he used like funny strategic point to get the public, telling like, oh, you will see the tallest person in the world. So everybody came, and during this time they received the vaccination. You will see that more and more when I will be showing you the other video clip, that is necessary to use maybe some kind of form of festivities or something on the cultural background that the people will get together. And in that time you will do the vaccination. So you cannot completely wait like, yes, I will do education and I will have the waiting in the physician office. It doesn't work if it's some kind of campaign doing the massive form of the vaccination. Okay. So did you learn a lot from this? You will remember that? Okay. So time is going to the level that I know you are waiting that just 5 minutes before we are ending this class. I'm letting you go under one condition, smiling. I would like to see smile in every face. When you are leaving this room, smile, doing some nice walking, breathing of fresh air.